obligatory quarantine of everyone coming into Canada is a serious further step. It's an important step, and it should make all Canadians feel much safer.
Isolation is now mandatory for almost everyone entering Canada. It goes into effect
part of the
midnight.
national package that went through the
Essential
Senate today, we're
workers
looking
are
at
exempt. Deputy Prime Minister Chrystia Freeland says the specifics of enforcing this under the Quarantine Act will be announced later today, so we will watch for those. Dr. Carolyn Snyder is Chief of Emergency Medicine at St. Michael's Hospital in Toronto, and she joins us now. You see her there. Thank you so much for giving us some of your precious time on this today. I want to jump right in and ask, first of all, your reaction to the government measures so far, both from the federal and provincial levels. And we just heard about the mandatory self-quarantine for any Canadians coming back into this country, for example. Do you think we have done and are doing enough to prepare for this?
So as a frontline emergency worker, we can do all sorts of things to prepare right now. We continue to prepare for this pandemic. But in reality, we need people to stay at home. And when people aren't staying at home, we need that to be enforced. And so I am very appreciative of these measures being forced now.
What does preparation look like at your hospital at St. Michael's?
So we very clearly know that we need to be ready at a moment's notice to care for a huge surge in patients that are affected by COVID. And so we've been making a lot of changes physically in our structures, but also in our flows and our pathways to ensure that when a patient comes to our doors at the front of the emergency department, they're quickly identified as potentially at risk of COVID or not, and they are streamed into two separate areas of our emergency department. So we've been doing that from a physical standpoint. Our docs are ready. We've been doing simulations, and our nurses and our whole teams getting together as interprofessional groups to prepare for everything that might come our way, and we continue to do that. So our preparation is ongoing. All of us are working around the clock so that we're ready should that surge hit us here in Toronto.
What is that like for you and your colleagues? As you know, the frontline healthcare workers are being called heroes in all of this. We know, you just mentioned staying up around the clock. How are you dealing with the stress of, I gather, preparing for what you think is going to be a big uptick?
Right. Well, you know, we're emerge people, and we're used to hearing that somebody's coming by ambulance getting CPR, or hearing that somebody's coming by ambulance with a trauma. And sometimes those coming right to our door really quickly with little time to prepare. But we're used to having that moment of preparation, standing together as a team, figuring out what we're going to do about that. And frankly, that same feeling, that feeling of anticipation, sort of a bit of a nervous anticipation, that's been going on for weeks for us in the emergency departments. And so it's some have said it's like being at the starting line of a marathon. We know that it is a marathon ahead of us, and we would love to be able to keep delaying that time when the pistol goes off. But if it goes off, we've got plans already in place. And if we get weeks to months ahead of us before that pistol goes off, that's even better, because we have all sorts of more things we could be doing to prepare, and we continue to prepare. But I work with an incredibly confident, really, really strong team. All of us are really working well together, and that's not just inside the emergency department, but frankly, across the whole hospital systems, across the Toronto systems. We're all working very closely together to make sure that we're all ready for this.
What is giving you hope? Are you seeing some heartwarming moments? So we see people, you know, in Italy, we're seeing them singing on their balcony. And in Ontario, we've seen people banging their pots at 7:30 in the evening to thank healthcare workers. Are there signs and stories that are giving you hope in this pandemic?
Absolutely. You know, that 7:30 p.m. time is important to me as a frontline healthcare worker, but I can tell you it is incredibly important to my kid and to the kids of many healthcare workers who aren't necessarily seeing us at home at 7:30 or at night, or seeing these hours that we're working. So if you're not out there banging for us, please bang for our kids and our families. That is huge for us. They are really feeling the brunt of this as a parent, as a family member. I know that the people that I live with and that care for me are worried about us, and so those moments are important. Other times I feel really heartwarmed are when I do drive home from work and I don't see anyone on a street. I think, God, people are listening. This is so important. We can do everything we can to prepare for this pandemic and a potential surge in the emergency departments, but we only have so much control. And in fact, I truly believe in this case that the most control actually lies with the individuals and their willingness to stay at home and abide by the physical distancing that is so important. I find it heartwarming when I see the really creative ways people are ensuring people stay busy and socially connected at home. And so those are really important to me as a frontline worker, because I know that it helps people stay at home. And that is by far one of the most important things that we can do.
Dr. Snyder, you are all doing such incredibly important work, and you've told us some of the things that warm your heart. This is your chance to tell Canadians, is there anything else that we can be doing to help you and your colleagues do your job?
Well, I think that it's important. I keep saying stay at home, please stay at home. Stay connected to the people that you care about using virtual methods and social or physical distancing, for sure, not social distancing, physical distancing. Please keep doing that. Knowing that you are doing your best makes us feel more confident to keep getting ready. And also remembering that I mentioned that we're preparing for the COVID, but we're still open. So if you're needing emergency care, please know you should still be coming. We have areas of our emerge where we refer to as COVID negative screened. I don't want somebody sitting at home if they're worried about a heart attack. We've got that in our plans too. So that is really important for Canadians to hear too.
An important reminder for us all. Dr. Snyder, we can't thank you enough for your time on this, and thanks to you and your colleagues for everything you're doing, and we'll do our part to help you. Thanks again.
Thank you.
Dr. Carolyn Snyder, Chief of Emergency Medicine at St. Michael's Hospital in Toronto.